President Obama has called leaders from both sides of the aisle to a healthcare summit today in Washington to help jumpstart his plans to overhaul the industry. For more on what to expect here, we're joined from D.C. by Dan Clifton, head of policy research at Strategas Research Partners. Dan, the president is doing his best to offer an olive branch to the Republicans, saying he's going to consider their plans and give them an opportunity to make their arguments. In your mind, is it going to make any difference?
Well, probably not. There's a new poll out this morning showing 3/4 of Americans feel the same way. It's not going to make a difference. You know, we basically have a situation where the president will say, I'll give you a provision here, or I'll take a provision out. But essentially, the Republicans are saying, let's start over. So there will be no agreement on those big type of issues in terms of where we're moving forward. And from there, the president can say, hey, I've given this olive branch to Republicans. They don't want to join us. I want an up or down vote on health care. And that will then provide the political cover, maybe, for the Democrats to move ahead on their own plan after the summit.
Dan, where should we expect to see the very sharpest dividing lines drawn today during this summit?
Well, I think that the first major dividing line is over spending. The president believes that you need to spend money to get more, meaning taxpayer money, to get more people insured. His plan calls for 30 million Americans to be insured. The Republicans believe that it needs to be more focused on cost and changing regulations. Their plan only covers 3 million Americans, but it actually has been scored as reducing costs by 10%. So that's where you'll see the dividing lines: access versus cost, and how much taxpayer money should be involved in the process.
Dan, this being Bloomberg, we do need to talk about the numbers specifically as they concern costs. An estimate of 25% of the $3.5 trillion that the federal government spent last year was dedicated to health care. How is this issue going to be batted around at this summit?
Well, I think that that's the real question. If we're going to put $1 trillion into this health care plan, as the president's proposing, that 25% of the federal budget will only continue to go higher. And what the Republicans are saying is the government's already in this game enough. It's got to come on the private side. However, the Democrats are arguing that escalating health care costs continue to grow, which is eating up a larger portion of the federal budget. And that's why we need to reform the health care system so that health care is not crowding out other government priorities such as education and road building. And that's a real major dividing line in terms of how we're going to do this on cost and its impact on the federal budget.
Dan, one of the president's major aims is to try and extend insurance to the so-called uninsured. By one estimate, 46 million people. Are the Republicans going to be willing to give ground here? Where is the debate going to be focused there?
Well, that's a very good question, because the president's plan would insure 31 of the 46 million Americans that are uninsured right now. But there's a dividing line in those numbers. 10 million are probably undocumented and illegal immigrants, very hard to get insurance to them. Another subsegment of the population, about 9 million, are younger and healthy Americans who just choose not to have health insurance. And without a strong individual mandate, which has become very controversial in Congress, mandating each individual get health insurance, it would be hard to get those younger and healthy workers into the insurance system. And I expect to see a fight over that, over whether it's even constitutional to mandate Americans get health insurance.
Dan, we've got about 40 seconds left. The Republicans would like to see the public get more involved in bearing the additional cost of health care, not the government. Where might we see some compromise?
Well, you know, that's a very good question. 5 out of every $6 spent on health care is actually paid for by a third party. And what Republicans are saying is, let's get the consumer more involved through health savings accounts, as well as buying insurance over state lines. And let me also say, defensive medicine is driving up the cost. Medical malpractice caps is something the Republicans will argue for today. I don't expect to see any resolution on these big issues, but it should make for exciting TV later on this morning.
All right, Dan Clifton of Strategas Research Partners with a look ahead to the healthcare summit.